Hello, we're going to continue on with this video with our lower limb bones. So we have our first bone, which is the patella. The patella is the largest sesamoid bone of the body. It's a round bone. Then we have the femur. When you look at the femur, you want to determine the anterior side from the posterior side. The way that you can do that is by looking at the condyles. If you look on the anterior surface, the bone is kind of nice and round and not quite as knobby. When you turn the bone to the posterior side, you've got two very large knobs on the posterior side. Those are called the femoral condyles. The way that you can tell medial from lateral is that the head of the femur is going to be medial, right? So that's going to fit into the acetabulum in the hip joint. So that would be the medial condyle, and that would be the lateral condyle. So let's look at the parts of the femur. There's a big list here that we have to know. The first thing that you have to know is the head of the femur. That's the big round ball on the end. It's going to be on the medial surface. On the head of the femur is a depression. It's called the fovea capitis, and I've got it covered here by my name. That's where it's found, so let's look at it on this bone. The fovea capitis is going to be right about here. That's not a great looking femur either. Let's see if we can find another one. Here we go. Here's the fovea capitis. We're going to have a ligament that attaches the head of the femur to the acetabulum and hold that ball deep in the socket. Okay, the next thing we have is the neck. This is the neck of the femur. So head and neck, fovea capitis. Then we have the greater trochanter and the lesser trochanter. The greater trochanter is going to be superior. The lesser trochanter is going to be inferior. These are knobby ends on the proximal end of the femur. So that's the greater trochanter. It's on the lateral surface of the femur. This is the lesser trochanter. Not to be confused with the tubercles on the humerus. So there's the greater trochanter and the lesser trochanter. On the posterior surface of the femur, there's a line that's where muscle attaches, and you can feel it. It feels like a seam, and it runs down the length of the posterior side of the femur. That's called the linea aspera. Linea aspera. Linea aspera. The larger the linea aspera, the larger the muscle, right? Because as the muscle pulls on the bone, it puts tension on the bone, and it causes more bone to form, so you get bony remodeling. And that's good because that increases the density of the bone. Okay, the next thing we have to learn are the lateral and medial condyles and lateral and medial epicondyles. Again, you find the head of the femur. That's going to be medial. So this is going to be our medial condyle. And the side with the tubercles on it is going to be our lateral condyles. When I turn the bone over, so we're facing anteriorly, you're going to find two areas of bony protrusion where the epiphysis of the bone is kind of at its widest point. Those are called the epicondyles. So those are the epicondyles. So that would be the medial epicondyle, the lateral epicondyle. This is going to be the lateral condyle and the medial condyle. Now we'll go onto our tibia. On the tibia, we have to find the medial and lateral condyle, the tibial tuberosity, and the medial malleolus. This is what the tibia looks like. It's got a flat surface that articulates with the femur. It kind of looks like a T at the top, doesn't it? And as I go down the bone, That's what the bone looks like. I'm holding on to the tibia. That's the anterior surface. This is the posterior surface. So, as we look at the anterior surface of the tibia, the top of the tibia has some depressions. That's where the C-shaped meniscus are going to fit, just like this. Just like this. It's also going to be where our femoral condyles articulate with the condyles of the tibia. So, how do we tell medial from lateral on the tibia? It's pretty easy. When I go to the distal end of the bone, the tibia is medial. The tibia is medial, and so this is the tibia, and the fibula is lateral. You have those bumps at your ankle, right? So there's that bump. If you feel down those bony bumps at your ankles, you got one on the lateral surface and one on the medial surface. Those are called the malleolus. So the end of the tibia with the malleolus, or the little bulge right here, see how you have a little bulge on this side? That's the malleolus. That's the medial malleolus. Okay. Up at the top of the tibia, we have what's called the tibial tuberosity. This is a protrusion of bone on the anterior surface where a muscle is going to attach. That's called the tibial tuberosity. So we have the lateral condyle, the medial condyle. The way we can tell those is because the medial malleolus is medial on the tibia. The anterior surface has that big protrusion of bone right there. That's called the tibial tuberosity. The posterior surface does not have a big protrusion of bone. As a matter of fact, there's more of a depression on the posterior surface. So we have the lateral condyle, the medial condyle, the tibial tuberosity, and the medial malleolus. The next bone we have is our fibula. The fibula is that long, thin, nondescript bone. So the proximal end of the fibula has kind of a little bulge on the end, on the epiphysis. That's called the head of the fibula. The distal end is kind of pointy. See how it points down here? Almost like an arrow or like a snake's head. So this end is where that bump on the lateral surface of your leg is going to be, where that bony bump is. That's called the lateral malleolus on the fibula. So there's your fibula bone. Okay, the last thing we need to look at is the ankle, the foot, and the toe bones. So there's a group of bones that make up the ankle bones. These are called the tarsals. This is not on your list. You do need to know your tarsal bones though. Not individually, just as tarsals. There's a couple of the tarsal bones I want you to know. The first one is called the talus. The talus looks like this. The end of the talus that articulates with the tibia is right here. It's smooth and flat and round and curved. So that's the superior end of the talus. The calcaneus is your heel bone, and it's more rectangular. And to me it looks almost like those Dutch shoes, those clogs maybe. Looks like it, the calcaneus. So here's the talus in the foot, and it's articulated with the rest of the bones. And here's the calcaneus. That's the big fat heel bone. We have our tarsals, our metatarsals, and our phalanges. So over here on this unlabeled foot, we have our big heel bone. That's the calcaneus. It's bigger than the talus. We have the talus. We have the tarsal bones as a group. We have the metatarsals, and we have the phalanges. That ends my video on the lower limb bones. Hope that helped. Have a great day. Bye.